Dr. Manivanan adalah dokter kepala medical officer di bagian A&E kita, bagian accident dan emergency, 5 tahun di Beacon Hospital, dan sekarang juga adalah tim dari senior management team di Beacon Hospital. Dan hari ini, pagi ini kita sangat beruntung bisa dengan Dr. Mani di sini. Ya, Dr. Mani, hari ini pembahasan kita itu betul-betul sangat serius, ya dokter ya. Ya, ini adalah mengenai tentang CPR. Ya, dokter bisa nggak menjelaskan kepada kita briefly meaning dari CPR?
Okay, first of all, CPR stands for cardiopulmonary resuscitation.
Yes.
So cardiopulmonary means involves the heart and the lungs. And usually, when do we actually conduct CPR? So CPR is usually conducted in terms of when the patient is unconscious, there's no pulse and there's no breathing. And also, there's no directive that this patient has already issued a DNR status, that means do not resuscitate. So we'll only conduct CPR for those who are unconscious, there's no pulse and there's no breathing.
So, jadi menurut dokter itu keadaan yang kita mesti lakukan CPR pada setiap orang ya?
Yes.
Maksudnya ya kita ketemu di mana, di rumah sakit, di luar ya. Jadi kondisinya mesti tidak ada denyutan.
There's no pulse, there's no breathing, and patient's unconscious. Actually, we'll do CPR for every patient, regardless they are infant, pediatrics, adults, elderly patients, as long as there's no directive saying that this patient is not to be resuscitated in the event of collapse. Because some patients know that they're very terminally ill, and they're still capable of making a decision, saying that I do not want to be done resuscitation, I do not want to undergo compression, or to undergo intubation in the event I am in a situation where I do not have a pulse. So some people can make a decision as such. So when you have a directive as given by the patient, you do not do CPR on such patients. Other than that, every other patient, regardless of infant, pediatrics or adults, we will do CPR.
Oke, jadi kita tidak akan membedakan dari usia ataupun kondisi pasien ya, bergantung dengan kondisi yang disebutkan tadi oleh dokter ya, mungkin tidak ada detakan jantung, tidak ada denyut nadi, dan tidak ada pernafasan. Untuk kondisi pasien seperti itu, biarpun mereka itu anak-anak, orang tua, kita tetap akan melakukan CPR. Benar ya dokter ya?
Yes.
For us to choose to do the CPR, is that called as a modern CPR and conventional CPR?
Actually, as far as from my understanding, there's no modern or conventional. CPR is the same ever since it existed. So, in terms of compression, as what I would like to explain is, it's the same procedure, regardless is it for infant, pediatrics, or adults. Of course, you do have single rescuers and double rescuers. What is the compression rate, depth, the ratio of compression to ventilation? That thing changes. If it's a single rescuer, double rescuer, if it's an infant, pediatrics, or adult, only that thing changes. But the fundamental of CPR remains the same. The main purpose that we do CPR is we are taking over the heart's function. What is the function of the heart? The heart actually pumps blood to all vital organs like the brain and all the other organs. So when a patient does not have a pulse, that means the heart is not beating. So that means there's no blood circulation to all the vital organs, especially the brain. So if you do not do anything, eventually these brain cells tend to die. And there are very slim chances of survival. So therefore, what we do in CPR is we will immediately start compression. So we are compressing the heart. So we are taking over the heart's function. What's the heart's function? Is to pump blood. So we are manually compressing the heart so that the heart will pump the blood to all the vital organs to keep those organs alive.
Oke, dokter. Ini kita kalau berdasarkan keadaan yang sebenarnya dokter ya. Kalau umpamanya kita lagi ada di satu ruangan, tiba-tiba ada yang pingsan. Terus kita seperti yang kata dokter, kita merasakan denyut nadi, detak nadi, dan juga jantung, dan juga merasakan pernafasan yang teman kita yang pingsan ya. Jadi kalau kita itu merasa kita itu nggak cukup pintar untuk melakukan CPR, tapi kita pernah lihat, kita pernah dilatih, jadi kita nggak usah bimbang ya dok ya, kita langsung melakukan aja gitu ya dok ya. Biarpun kita itu bukan yang sangat ahli, bukan expertnya, tapi kita perlu memberikan pertolongan pertama. Jadi pertolongan pertama yang kita berikan itu yang detik-detik pertama itu betul-betul sangat penting ya dok.
So it's very important. The moment you witness someone collapse, immediately you do a quick assessment. Patient's unconscious, there's no pulse, there's no breathing. Immediately you have to initiate compression. Why? Because every minute is very important because you want to improve patient survival. So if you delay compression, that means you are delaying blood circulation from the heart to the brain. The brain cells will tend to die. And you will actually lead to permanent brain death. So the moment you identify a patient has collapsed, there's no pulse, there's no breathing, immediately you have to initiate CPR, compression. So at least by compressing, proper compression technique, you can keep the brain alive.
Oke. Jadi ini berarti yang paling penting kita lakukan itu adalah compression. Setelah itu baru dilanjutkan dengan, saya lihat juga ada dari pernafasan dari mulut ke mulut. Jadi kapan kita melakukan pernafasan dari mulut ke mulut?
Okay, so what happens is when a patient has collapsed, okay, the lungs has enough of oxygen reservoir. Okay, so usually your lung has, in a normal individual, the saturation is more than 95%. So when a patient has collapsed, the lung is still able to sustain a certain amount of oxygen reservoir. So you do not have to immediately give ventilation. Mouth-to-mouth ventilation is not immediately required. You have to start with the compression first. So usually in terms of BLS, basic life support, after you've identified patients unconscious, there's no pulse, there's no breathing, you start compression first. So you do 30 compressions and then you go to 2 ventilations. Of course, when you see a patient or anyone on the roadside has collapsed, there can be some concern that you want to do mouth to mouth because you're not sure about the patient's status, HIV status, VDRL status, the vital status you're not very sure and you're worried that it can be transmitted to you. So in such situations, what you can do is hands only CPR. That means you only do compressions alone. You do compressions, 120 compressions, about 100 to 120 compressions in 1 minute. So you do it for 2 minutes and then again you reassess for pulse and breathing. So if you're concerned on patient status, vital status, you can only do hands compression only.
So itu maksudnya hand only CPR.
Correct.
Ya. Dan dokter kalau umpamanya di jalannya dok ya, kita lagi mau melakukan CPR, terus pada waktu yang sama berarti kita tindakan apa yang kita perlu buat? Kita langsung panggil ambulans atau?
Okay. So say for example, you have witnessed someone collapse on the roadside. So of course, the first thing you do is you quickly go and assess the patient.
Correct.
You go and assess whether the patient is alert or not. So you tap on the patient's shoulder, sir, are you okay? Madam, are you okay? They are not responding. Then what do? You call for help. Any passerby, can you please help me to call 999? But when you call 999, it goes to 3 departments. It goes to ambulance, it goes to police, and it goes to bomba. So you have to give a very clear instruction. Can you help to call 999 for ambulance service? And also help me to get an AED. Automated external defibrillator. So these are the 2 directives that you have to give to the passerby. After you have asked for help, then what do you do? Then you check for pulse and breathing. Not less than 5, not more than 10 seconds. After you've assessed for pulse and breathing, there's no pulse, there's no breathing, then only you immediately initiate compressions.
So itu langkah-langkah yang perlu kita ingat kalau kita ada lihat yang orang yang memerlukan bantuan di jalanan. Dan kalau di Malaysia kita akan menghubungi 999. Ya tergantung kalau nomor di Indonesia itu bisa lain ya. Dan setelah kita ambil inisiatif untuk semua yang dikasih tahu oleh Dr. Mani tadi, untuk departemen mana ya, dan AED ya tadi dokter sebutkan ya. Jadi itu betul-betul penting. Baru kita akan memulaikan compression ya. Dan satu yang tadi dokter bilang itu adalah maksudnya dengan defibrillator yang untuk membantu pasien setelah dengan CPR ya dokter ya. Jadi kalau CPR tidak jalan, kemungkinan begitu ambulans tiba kita bisa bantu.
Okay, CPR alone, chances of survival is only 25%. So CPR is not the definitive treatment. CPR is only going to prolong the survival. See, most of the patients, elderly patients especially, when they collapse, one of the main causes of them to collapse is cardiac arrest. Okay, so in this cardiac arrest, there's 2 rhythms that the AED, automated external defibrillator, can pick up. One is ventricular fibrillation VF and one more is pulseless VT, ventricular tachycardia. So these are the 2 rhythms usually will exist with cardiac arrest. So by us doing CPR, we're just going to keep the brain alive, but that's not the definitive management. So when I talk about these two rhythms, pulseless VT and VF, the heart rate is about more than 200 beats per minute. A normal individual's heart rate is from 60 to 100. When it goes about 200 beats per minute, you cannot even feel. It's very, very rapid. The amount of compression, that means the heart beating is so inadequate where it does not supply enough of blood to the vital organs. So patients tend to collapse. So what does the AED do is AED will help to determine, is it a shockable rhythm or not? Is it a pulseless VT or a VF? If it's a pulseless VT or VF, it's able to give the shock, the 200 joules of shock. So when it gives the shock, it jump starts, hoping that the heart will go back to normal sinus rhythm, to normal 60 to 100. So that's the main concern here. So CPR is only going to prolong survival. It's not the definitive treatment. Of course, AED will help. CPR alone is 25% of survival. Together with an AED, it increases by 50% of chances of survival. So it's very important. We do CPR to keep the brain alive, but eventually we will need the AED to come in to see if it's a shockable rhythm. If it's a shockable rhythm, we'll try to shock the patient to see if we can restart back the heart to normal sinus rhythm.
Okay. Thank you so much, Dr. Mani. Itu betul-betul session kita hari ini itu bisa membantu dan menyelamatkan nyawa seseorang. Dan menit-menit pertama dan semua informasi yang kita ada pada hari ini itu sangat berguna untuk kita dalam kehidupan kita sehari-hari. Dan kita juga akan menunjukkan bagaimana CPR dilakukan pada pasien ataupun seseorang yang memerlukan bantuan. Kita akan lihat video berikut ini. Terima kasih.
Today I'm going to teach on the practical session of how to do a CPR. So say for example you're on the roadside and you happen to see someone unconscious by the roadside. Okay, so how do you attend to the person, to the individual, to the casualty? So how we do is we follow this algorithm in BLS called DRCAB. So first, D stands for danger. So danger, the most important thing is you must make sure that the scene is safe for yourself as well as for the patient. Say for example, if it's by the seaside and the patient is drowning, so the danger here is the water, so you have to take the patient out of the water. That's important. So make sure the scene is always safe for yourself as well as the patient, so that's the danger. Second thing is responsiveness. How do you check for responsiveness? R is for respond. How to check for responsiveness? Because we had to tap on the patient's shoulder. Sir, are you okay? Is you okay? Huh? Can you please call 999 for ambulance service and help to bring an AED, automated external defibrillator. So that person has already went to find for help. The next thing I will do is I need to check the patient's pulse as well as the patient's breathing. So I check for patient's pulse at the carotid artery over here, and also check for the breathing. How to check for breathing? I need to see for chest rise. So I will do simultaneously. I'll check for pulse and breathing, not less than 5, not more than 10 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Once I'm certain there's no pulse and there's no breathing, then I'll start on my chest compression. So how do you do chest compression? A patient is lying down flat as such. So between the nipple lines, center of the chest, so that's where you place your hand. My dominant hand is the right hand. So therefore, I'm going to use the heel of my right hand. I'm going to use my left hand to interlock. You lean towards the patient 90 degrees perpendicular. You're not going to use the strength of your arms or shoulders. You're going to use your body weight. Okay, lock your arms and shoulder perpendicular and you exit. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So for adults, usually the rate is not less than 100, not more than 120 compressions per minute. The depth is about 2 to 2.4 inches. At the same time, when you're a single rescuer, when you are doing the compression, you do 30 compressions, like how I mentioned to you earlier. Then you give 2 breaths, 2 ventilation. So in public areas, you do not have all those medical equipments like bag, valve, mask and all. So what you can do is, say for example, if it's your family member, you would want to give mouth-to-mouth ventilation. So how do you do for adults is, you have to head tilt and you have to chin lift because you have to open the airway. When a patient has become unconscious, the tongue will drop and it will obstruct the airway. So you head tilt, chin lift to relieve that obstruction. And before you give mouth to mouth, you have to close the nostril, and then your mouth will seal the mouth of the casualty, and then you give one breath over 1 second to see a proper chest rise. So you give 2 breaths, and then you come back to 30 compressions. I will reiterate how you do compressions is between the nipple line, center of the chest. Use your dominant hand, just the heel. The left hand is to interlock. Lean towards the patient 90 degrees and you compress. At the same time, when you compress, you have to recoil. Only when you recoil, so when you compress, you're pushing the blood out of the heart. When you recoil, when you relax, you're letting the blood to flow into the heart. So if you do too rapidly, so you can even see from this light indication, if I do too fast, you can see a yellow color light that's blinking. That means you're not doing accurately. Can you see the yellow light? So that means this shows that less blood flow into the heart, less blood exiting the heart as well. So for proper compression technique, your compression as well as your relaxation, that means your recoil, is very, very important. That means you need enough sufficient blood to enter the heart for it to exit the heart and supply all the vital organs. So therefore you compress at a rate of 100 to 120 compressions per minute. So if you notice, the correct technique is you must have 2 green lights blinking. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt, chin lift, close the nostril. Give 1 breath over 1 second. 1, 2, 3, 4, 5. Close the nostril, head tilt, chin lift. Another breath over 1 second. See for chest rise. And you go back to your compressions. So you do this for 5 cycles. 30 compressions, 2 ventilations. That's equivalent to 1 cycle. You must do 5 cycles. That's equivalent to 2 minutes. After you have completed for 2 minutes, then only you check for pulse and breathing. Until you get assistance, so if the helper comes in with an AED, then you have to connect the AED to see is it a shockable rhythm or a not shockable rhythm. If the shockable rhythm, you have to give shock immediately. As what I mentioned in my previous lectures, most of the time adult patients, they will collapse because of cardiac arrest, and this cardiac arrest might be because of pulseless VT, ventricular tachycardia, or ventricular fibrillation. Your CPR is only going to keep the brain alive, but that's not the definitive treatment. The definite treatment is to provide, if it's a shockable rhythm, to provide the shock. It's like a jump start to the heart, hoping the heart will come back to normal sinus rhythm. So if it's a shockable rhythm, immediately place the plats, follow the instruction by the AED. If it's a shockable rhythm, provide the shock. Right after the shock, do CPR again for 2 minutes, then you reassess the patient.